Thank you and welcome to the show this morning. The topic this morning is cancer care, from diagnosis to survivorship. And we're fortunate to have with us two individuals to talk about cancer care from diagnosis to survivorship. Dr. Excuse me. I busted that. Dr.
Stephen
Wolff. I'm sorry, Dr. Wolff.
Not a problem.
And Miss Beverly Weatherspoon. We're sorry about that. Who will talk about some instances in reference to the topic today. And so let's start off, Dr. Wolff, with this mental block that I had all of a sudden. Let's start off by having you and Miss Weatherspoon to give us some information about your background, your education, and some of the things that were important in terms of bringing you to us this morning, after which we'll have an opportunity to talk about the cancer program that you are the director of. And let's start off with you, Dr. Wolff.
Well, thank you. So I'm going to show you my age now.
Well, you'll also show me mine. Okay.
Sure.
Okay.
So my career was mostly at Vanderbilt University. I spent 20 years as one of the cancer doctors there. And then a few years ago, I decided that I wanted to sort of give back to the community. And I moved to the General Hospital to take care of cancer patients there. I should tell you that many years ago, when I was a young doctor, learning how to be a doctor as an intern, I spent many sleepless nights at the old National General Hospital on 2nd Avenue. And I thought that working at that institution now would be a great way to fulfill my career obligations.
And so you're at General Hospital now,
Right.
with the Cancer Care Center, and you're the director of that.
Yes.
Okay.
So I did my internship and residency at Vanderbilt. I did medical school at the University of Illinois, and I'm initially from New York, but I'm now proud to say I've been living in Tennessee for over 30
Very
years.
good. Very good. Of course,
I'm a Tennessean now.
That's very good. And of course, I know your Vanderbilt relationships and et cetera. I started at Vanderbilt back in don't want to reveal my age. I'm 70 years old. Ms. Weatherspoon, why don't you give us some information about your background and education and that kind of information?
Well, I'm a surgical physician assistant. I have my master's in science medicine that I got here at Trevecca University in Nashville. And my undergrad's from Austin Peay State University, so I am a Tennessean as well.
Very good. And of course, Dr. Wolff, let's see if we can start off by talking about the center that you are the director of. Exactly what does this mean? I mean, what kind of center is this Cancer Care Center?
So I'm very proud to be here, actually. We have a full-fledged cancer center and cancer program at the National General Hospital. That means that we can take care of any patient from the start of therapy to the end of therapy, and we have availability, all sorts of resources there.
And so you've got a very, very successful program already, and you want to talk about that program today. And what are some of the things that you would like to talk about today dealing with this program?
Well, I think that Beverly and I are going to talk about cancer in general.
Okay.
We're going to talk about what risk factors there are for cancer. I think most importantly, we're going to talk about how to lower your risk of developing cancer. And maybe least important, because most patients will never face this, I think we'll talk about what to do if you suspect you have cancer, and of course what to do if you're diagnosed with cancer.
Okay, well, let's start that off by having you to begin, and then for the next couple of minutes, then she'll introduce some information in reference to some of the things that you've said, and then we'll end this first segment with those statements, and then we'll come back with an 8-minute segment and really start talking about the issue.
So I think that the average person never believes that they can get cancer, or that anybody in their family could get cancer. So let's put it into a personal level. Dr. Haney, your risk of getting prostate cancer, your risk is 1 out of 6. That means that by the time you get to be even older than you are now, you're going to likely have a great chance of getting prostate cancer. Now for Beverly, over her lifetime, the risk of her developing breast cancer is less than 1 in 10. That means out of every 10 women, more than 1 is going to get breast cancer. Now, so that's a pretty common illness.
So prostate cancer is a real problem that you deal with.
It's the most common cancer there is.
I also understand that that's a real problem among African American men. Is
Right. There are some groups that specifically have increased risk to developing certain cancers. African American have an increased risk of developing prostate cancer. A blood disease called multiple myeloma And although they don't get breast cancer as often as Caucasian women, if they get it, it's generally worse. So there are different risk factors for cancer.
What do you have to say, Ms. Beverly Witherspoon, about the possibilities of people contracting cancer or some other disease that is peculiar to women?
Well, it affects all of us. We all know someone or a family member, a friend, someone who's either survived cancer or is going through it now. And it affects us because the incidence of cancer just increases with age, period. It doesn't mean you have to have a family history of it. And in the breast center, most...
And we're going to have to take this first commercial break, after which we'll come back and pick up at the... And we'll be back with our audience following this short commercial.